Welcome to 50 Plus in Montgomery County, a monthly program that is a voice for many, produced by the Commission on Aging, of which I am an alum. This show is insightful for people of all ages, and each episode takes a fresh look at important issues by spotlighting older adults in the community, representatives of services and programs, and activities of interest to older adults. My name is Katie. On this month's show, we're going to talk about medication safety and management and healthy aging. Here to have that discussion with me is Dr. Brandt. Welcome, Dr. Brandt.
Thank you, Katie.
Dr. Brandt is the Executive Director of the Peter Lamley Center on Drug Therapy and Aging, and you're a professor with the Department of Practice Science and Health Outcomes Research at the University of Maryland School of Pharmacy?
Quite a mouthful.
Okay.
Yeah. Absolutely. Yes.
Well, Dr. Brandt, let's just jump right on in.
Sure.
Can you share with us a patient's journey when managing medications as you get older?
Absolutely. Katie, I mean, it's such a privilege to get older. So I love the point of this program is to talk about healthy aging. So I'll start with a patient's story. As a practicing pharmacist, you know, I have many titles, as you read, thank you. But as a practicing pharmacist, which is actually near and dear to my heart, is the journey our patients have to take to get their medications. So just last week, we had a 75-year-old woman who came into our practice. I'm fortunate, I work in an interprofessional practice with physicians, nurse practitioners, social workers, community health workers, and pharmacists and physical therapy, a true team approach. Yes. So this woman was coming in with a family member who was concerned about her memory, who over the age of 50 is not concerned about their memory. But we worry within our clinic when people start having memory that interferes with their day-to-day function. We call that dementia. And oftentimes one of the concerns people have is if I'm developing Alzheimer's disease. As a pharmacist, I think about, could these medications be worsening someone's memory? And oftentimes as we get older, we hear from our peers and our friends, oh, what about this supplement? We see multiple prescribers and they prescribe different medications, sometimes for our heart, sometimes for our mood, sometimes for our sleep. So this 75-year-old woman, it was a similar story, self-treating because she thought she was a little bit more forgetful to the point where she was not managing finances as well. Her son and daughter were concerned that she was getting lost at times in the car. We call those higher level executive functioning. Because she was taking about 7 medications and 5 of those were prescribed. 2 were over-the-counter supplements, something for her bone, something for her sleep, and something she was thinking about starting for her memory. And so I say that because I think when we think about our journey, sometimes we treat ourselves with over-the-counter medicines. We may actually share medicines with others at times, and then we're seeing multiple prescribers. And I think it's really important as we get older to think about the complexity of navigating that journey, especially when you start to have concerns with memory. So, and with her list of medications, Katie, there were some medications that were potentially problematic because of the drug interactions or the potential for worsening her memory. And that's why, as your pharmacist member here today, I think it's really important that people have those discussions with their healthcare team, including their pharmacist, to look at that medication safety, which we'll take a little bit of a deeper dive into, I know, together.
Dr. Brandt, I want to jump around here a little bit with our questions, because you mentioned taking many medications at the same time, and I learned that that's called polypharmacy. Like, what are the warning signs that patients and caregivers should watch out for?
Okay, so I'm going to take a deep dive into the word polypharmacy. When I think of poly, I think of many. When I think of pharmacy, I think of the physical building where people get their medicines, right? So polypharmacy could be that you're using many pharmacies to obtain your medicines. Sometimes people get them online. Sometimes people go to a brick and mortar place. Or sometimes people order them through the internet or mail order. There's so many places where people get medicines from. I think what you're thinking of polypharmacy is typically more than 5 or more medicines, 10 or more medicines. In the recent literature, hyperpolypharmacy, you know, greater than 10 medicines. And I think what the signal there is, are there more medications than clinically indicated? So in my mind, polypharmacy AKA, or also known as polymedicine, is really a signal, are we taking more medications that are clinically indicated? And I think it's really important as we think about the aging journey, our healthcare needs change, our goals of care change, and so the signal of using more medicines than clinically indicated, also known as polypharmacy, as you touted, is something that caregivers should be mindful of, because you may not need all of those medications, especially if one advances in their illness and they're more towards the end of life. So it really gives you that opportunity to look at it, or if your goals of care change. And that becomes a big discussion when we think about blood pressure or even diabetes management.
Okay, Dr. Brandt, as our healthcare needs,
Yes.
or our healthcare goals, I should say, and or our care goals change, we definitely need our trusted pharmacists. So with that, can you talk about the importance of medication safety and how we optimize its significance?
Yeah, so medication safety is, I always signal to caregivers and patients, a conversation that starts with when you start a medicine. How do you best know how to take that medication? How do you store that medication? You know, and I'll take a deep dive into administration of insulin. People often think about insulin. Insulin might come in a vial or it might come in a pen, right? And so there's different techniques on how to best use a pen device versus drawing up medicine or insulin out of a vial. So administration is key. That could be an inhaler too. So we're not born knowing how to administer medicines, so it takes some education and training to optimally administer a medicine. And then what is the best time of day to take a medicine? Because if you're taking some medicines with food, it might actually put you at a risk for that medicine not working as well, or maybe it's going to enhance the medicine effect. Or it might protect your stomach from having some of those adverse effects, so another safety aspect. And then when we think about storage, so some of maybe our individuals who are listening to this are taking pain medicines, also known as narcotics or opioids. Are we storing them in an environment that nobody else has access to them for the potential of diversion, but also if someone were to take them accidentally, could they overdose? And so sometimes we have on hand, if people are taking pain medicines on a regular basis, things like naloxone. And then when we're done with medications, or they are expired, or we're no longer using them, how do we dispose of them? Right? And that's a big environmental concern for our water systems, for our landfills. How are we disposing of these medications? So we actually worked with the Maryland Poison Center on putting together a pamphlet on how to best dispose of medications, or if they're controlled substances, those take-back days, which is safe for our communities too. So I think, and just thinking, even if we throw a vial out, I often say to our patients, make sure that you black out your name and the information about those medicines on that vial if you're putting it into your garbage, because you never know who might be going through your garbage. So there's a lot of safety aspects in terms of the medicines themselves, but the way in which we use them, the way in which we dispose of them. So in that self, it's just a journey in terms of how you best manage your medications.
That's right. With the disposing of the medications, is it true that many pharmacies do have a dispensary where you can take it to?
So in health systems, for the health system I work in, right outside the pharmacy is this green bin of where you can dispose of medicines. But again, when you're disposing of them, make sure there's nothing identifiable on them. And there are substances that you cannot take there to be disposed of. But you can check with your local pharmacy and or potentially police department for some of those controlled substances.
Okay.
Yeah.
You know, you've been doing a lot of work with the age-friendly ecosystem, and you brought a prop here today.
I did, Katie,
I would like
for you.
Thank you.
Yeah.
If you could tell us about the 4 M's, which I see are what matters, mobility, mentation, and medication.
You got it.
Okay.
So this is part of, thank you, Katie, and just a little thank you for having me here today. So the 4 M's, which is part of the age-friendly health system. So as a healthcare provider, we're affiliated with different healthcare systems, hospitals, nursing homes, ambulatory care centers. So the Institute for Healthcare Improvement, in combination with the American Hospital Association, Catholic Charities, funding through the John A. Harford Foundation, put together this movement in about 2017, 2018. So we're almost 10 years into it. And they built on this framework of taking standards of care, great standards of practice and bringing them together. Oftentimes in healthcare, we're kind of in our silos, but this really tried to break down the silos in terms of providing person-centered care, patient-centered care. And really getting at the crux of that is what matters to that patient. Oftentimes we ask you, what is the matter with you, instead of what matters to you, right? And as we get older, I think we all have a sensitivity of that what matters to you. Saw a woman just the other day, she said to me, playing with my grandchildren, being able to breathe when I walk up the stairs with my groceries, that's what matters to me because I want to be independent. And I bet a lot of your listeners feel that same way of what matters to me is that independence and function. And so the other three M's really complement each other in terms of medications, which we're talking about today. But we know some medications could worsen someone's mentation, just like we started the journey in the case with, but they can also worsen someone's mobility. And when I think of mobility, we think instantaneously of falls. But what kind of environment is someone living in terms of safe mobility? Whether it's your home, whether it's your community. And so that's where the construct of age-friendly ecosystems. And I know our state, and a big applause to Governor Wes Moore for putting into place the longevity and aging. Right?
Yes, Longevity Maryland.
Yes, Longevity Maryland. Thank you, Katie. And part of that is really us working together as an ecosystem on instilling age-friendly philosophies and practices and policies and health systems and training programs and community-based programs. And I think thinking about that we are in this together. And so it's a lifespan and it's life choices, and thinking about even here in Montgomery County, all the amazing work that you all are doing to help with some of those aging policies and programs. So, and that's what that age-friendly ecosystem. So in the health systems, what we're doing is bringing programs together. And this in, actually not this year, but in 2025, just last year, I can't believe it's 2026, time flies. But in 2025, the Centers for Medicare and Medicaid Services, the federal agency that pays for a lot of health care for our older adults, put together an age-friendly hospital measure. And that hospital measure is making hospital systems rethink some of its aging programs, because they're caring for a lot of older adults within those hospital systems. And it not only does that hospital measure focus on the 4 M's, but it focuses on leadership, and it focuses on social vulnerability. And what are we doing to look at our social environment when we send someone home from our institution? So it's really instilling how are our hospital systems talking with our pharmacies, how are our hospital systems talking with our community area agencies on aging, how are we working together to help people age in place? And that's really been a passion of the work we've been doing at the University of Maryland, because in 2019, before the pandemic hit us all and really derailed some of the programs we were offering, but also united us in a different type of way when we think about how we can work together in a more patient-focused perspective. But we brought together the age-friendly university programs with the age-friendly health system programs. And so we've been very intentional at the University of Maryland, Baltimore, University of Maryland, Baltimore County, and just recently the Towson University, of how do we train our workforce to be more mindful of helping our community age in place.
Wow. So when you mentioned leadership, that's leadership from the payer, provider, and patient side? Okay.
Yeah. So it's a strong signal in terms of how we need to work together to make programs that are sustainable and are compensated for. Right.
I want to go back to, this really resonated with me.
Yeah.
What matters to you?
Yes.
You know, not what's the matter, but what matters. How do we get patients to care about medication safety from the administration or administrative perspective? Like when you administer the medicine, how do we get them to like really care, like you have to do this appropriately?
You know, I think...
How can that matter to them?
Oftentimes what I hear from my patient, what matters to them is sometimes the cost of medicines, right? It's expensive. So if you're going to use something, you want to make sure that you're optimally using it, right? The timing of day, the frequency, and if cost is a concern, it's going to interrupt the therapy, that's not safe either, Katie. Stopping and starting medications. Patients can go through adverse drug withdrawal events, which they don't even think about, but it also can signal that their disease states aren't really well controlled. So, and if they were then started on all those medications, God forbid they got hospitalized because one of those disease states, like their blood pressure wasn't controlled, and then all of a sudden at the hospital they see this list of medicines and they restart everything, their blood pressure could drop too low. But getting back to shifting of how that becomes something of what matters to them, people don't want to go into the hospital. They want to know how to optimally manage their care. And I think having those conversations with your providers, again, the pharmacist is part of that healthcare team, to best understand the timing of medications. And if you're having difficulty with it, maybe it's the vision and you can't see the medication label so well. Or maybe it is your dexterity and you can't administer that inhaler as well. There are a multitude of devices out there or assisted devices that might help with it. And sometimes you need to lean in and lean on family and caregivers to help support you, to remind you. There's also technologies in that way in terms of reminders. But sometimes that humanistic touch, I have to tell you, Katie, especially with aging, is so pivotal.
It doesn't go out of style.
It doesn't go out of style, right? And you don't have to update it, you know, unlike an app. You know, it really just connects with that person. And I think that's what that, you know, meeting a person where they're at from both a, you know, a literacy, health literacy, technology perspective. And I think that's where we became united during the pandemic, is really realizing some of the limitations with just sending someone to a website. You need that personal touch.
And you also mentioned team, and I'm sure that team helps patients' anxiety to be reduced when they are thinking about, oh, the cost of my medication versus am I safely administering my medication or taking my medication. You have a team of people, those wraparound services that are just helping to alleviate, I guess, that added concern.
I think, you know, it's really wise in a world where, you know, people are very busy. You know, you may be looking just at Dr. Google for the answer, but having that confidence and ability to confide in a healthcare team is very helpful to navigate, because there's complexity to the medical conditions you're being treated for, whether maybe it's your kidneys that change not only with aging, but change with diseases like chronic kidney disease, which is pretty pervasive as we get older, especially with uncontrolled high blood pressure or diabetes. So the medications might need to be dosed differently. And so there's aspects of that that can lead to safety. So 100%, I think that team does reduce someone's anxiety.
Well, let's talk about self-treatment a little bit more. Obviously, many adults, older adults, are taking multiple medications, and a lot of people assume that over-the-counter or OTC medications are completely safe. But what should older adults know about the potential risk of OTC medications and supplements?
Great question. You're right, Katie. It's like $1 billion business that's only growing in terms of the number of supplements that are out there and the different sources of the supplements. So let's start first with vitamins. Most people can resonate with vitamins, and probably the classic vitamin is vitamin D, as in dog, right? You need it for your bone health. There's been some implications in terms of cognitive health and muscle strength. So vitamin D is a lipid-soluble vitamin, meaning that it can accrue in our system if we take too much of it. So sometimes patients, and we had this last week, sometimes patients take prescription vitamin D because someone starts them on it because their levels are too low. But then they continue and continue and continue. Then they start taking a multivitamin, which has vitamin D, and then they might be taking another vitamin D. So you can actually get too much vitamins, and that might not be good for your heart or your kidneys. Okay, so yes, too much of vitamins can happen. Or you could be taking vitamin K, which helps with the clotting factors. Not a good choice if you're taking things like warfarin, which thins the blood. Okay, so there's those type of vitamin and potentially drug interactions as well. Now we'll open up Pandora's box, what I like to say, with people with their herbal supplements. Because if it comes from an herb, it's safe. Well, things like digoxin came from foxglove, and we used digoxin, and it can too little or too much can be problematic in terms of causing toxicities. So yeah, some of the original medicines that we've now created into pills came from herbs. So we need to be mindful of that. So some of the herbs that are commonly used, like garlic or ginkgo, can also thin your blood. Okay. So if you're taking aspirin, or you're taking other types of antiplatelets like clopidogrel, or you're taking other types of blood thinners like the DOACs that you see on many commercials, apixaban or Eliquis, you can increase your risk of bleeding. And there's other medicines that can increase your risk of bleeding. And the thing is, as we get older, we're at greater risk for stomach bleeds, and those can be catastrophic for some of our older adult patients, especially if they're frail. So yeah, so I say to our patients, check, because these, and the other thing about herbs and some of these supplements, many of them actually, they're not standardized. They're not necessarily studied very well. There have been some that have had false claims, and they've had to, such as Prevagen actually, with false claims against it. And so the company had to recall some of the claims that it was making. So, you know, they are for-profit organizations, and so to be mindful, there are some standards like the United States Pharmacopoeia that may endorse some of our vitamins, and so when I'm telling patients, take a look at some of those standards. And if you want to try them, because there is some clinical merit with these supplements, check with your providers just to make sure that you're not putting yourself at risk. Both a financial risk, because they can get very expensive, but also the safety risk, and that's where that journey started with medication safety.
Dr. Brandt, I really, full transparency, I want to like sink down in my seat a bit.
No sinking in your seat.
I take my multivitamin, I might take my garlic supplement, I might take my biotin, I might have all these separate things. I'm like, I'm doing well, and I'm taking my ginger shot. It's just,
but Katie, and there's nothing necessarily wrong with that. But to be mindful that as we get older, that we might be taking other things too. And for instance, the biotin, you've got to stop the biotin before you get your thyroid tested, because it affects the thyroid test. Right? So it's like these nuances to these supplements that we need to be mindful of. So,
okay. Well, you said talking to your physician. So as patients prepare to go into a meeting with their doctor, what kinds of questions should they be asking? In addition, should they also disclose all these supplements they're taking?
They should definitely disclose the supplements they're taking. Now, depending on the plethora of them, sometimes our medical provider teams might feel a bit overwhelmed. I'll be honest, I've had patients come in with a suitcase of supplements, and partly because of just what was going on cognitively and executive function being not great, so they were ordering a lot of things online that the family discovered when they were doing a spring cleaning. So it can be a little overwhelming. I use a resource, and I've shared this with some of the providers I've worked with, Natural Medicine Pro, to look up the supplements. We had a woman just the other day, she was taking about 12 supplements, ran them through a drug interaction, compounded that with her prescription medications, and she was at risk for bleeding from some of these supplements. So I think the key thing is to, yes, share and disclose. And Katie, that doesn't just include those supplements you buy in a bottle, but it could include things like alcohol, as well as substances like marijuana, cannabinoids, and THC, which patients may be using or ingesting in different formulations. Because, and smoking. All of those have certain effects on maybe some of the way the medicines are metabolized, or compound some of those side effects that could increase the risk of falling. So yeah, our body doesn't necessarily know where it comes from, but it has different effects in different parts of our body, which may give us some, you know, relief in pain or anxiety that we're seeking from these substances, but the same token might be interacting with some of our other medications.
Let's focus a little bit on medical marijuana. It's something that many people are curious about. What should older adults know about its potential benefits and risk? when they're already taking other medications? You can elaborate a little more.
Yeah, absolutely. Great question, Katie. I think first and foremost is just like the supplements, to have that conversation. What are you hoping to have it help with? You know, the literature is sometimes, honestly, in terms of the science and evidence, is mixed on its effectiveness. Part of it has to do with the dose. Part of it has to do with the combination of cannabinoids with THC. I look at it as from a safety perspective. Many of our older adults are already taking medicines that affect their brain chemistry. So this might compound it. They might also be taking medicines that affect their blood pressure. This could also potentially drop their blood pressure. So being mindful of it, let alone the source of which they're getting it, hopefully getting it from a medical dispensary, a marijuana dispensary, so there's some sort of awareness to the dosage and formulations. But I've had patients getting it from street sources, which is not safe because of what's happening in terms of manipulation of some of those sources. So I think the first step is why. Second step is where you're getting it from. And third step is, how do we monitor for that? And monitor, is it safe for you? And then monitor, is it effective? Just like many prescribed medicines that we might use for those same indications, sometimes they help and then they don't help after a period of time, so we need to reevaluate that. Especially sleep meds. You know,
like melatonin, stuff that has melatonin.
Yeah, so I mean, melatonin, sometimes people say it's effective, sometimes they say it's not as effective, depending on the formulation, the timing in which they're taking it, and what are they taking it with. So, let alone if they're in front of their iPad till the middle of the night, or watching some sort of graphic movie, or, as patients have said to me, news, which can be very disturbing. So yeah, so I think it's just, you know, you need to look at both the pharmacologic approaches, or medicines as I call it, but also what's happening non-pharmacologically, because sometimes we set unrealistic expectations that this pill or this intervention is going to fix everything, right? That we need to be mindful of that.
Oh, Dr. Brandt, you know, you're in our heads, but I definitely want to get to this question, and I only have 1 minute.
Okay, 1 minute.
But yes.
Where'd the time go?
Where did it go? I want you to tell our viewers about the Peter Lammy Center on Drug Therapy and Aging, and your involvement in the Elder Care Medicine Network, if you could do that in about 45 seconds.
I can make it very quick. So the Peter Lammy Center on Drug Therapy. Yeah, that's okay. On Drug Therapy and Aging is housed within a school of pharmacy on a campus with an interprofessional team members. Our focus is on education, we're a university, on clinical service, where we provide practice across different care settings. It's also involved in terms of advocacy and scholarly work. The center's been around since 1978, so its mission and vision has not changed, which is improving the lives of older adults and those who care for them through these different initiatives. And in terms of the Elder Care Medicine Network, it was a network that was created initially with some funding from PCORI, Patient-Centered Outcome Research Institute. Thank you for that funding. And that network was created to really engage older adults, caregivers, pharmacists, and other researchers working together to put together medication concerns. So through that work, we put together some training programs. We also do encourage older adults and caregivers to get involved with us in research. So we're actually doing a survey on getting an older adult and a caregiver's perspective on what is an age-friendly pharmacy. We didn't get to talk about that, Katie, but age-friendly pharmacies in the community that are providing services to help people older adults age in place, such as medication management, understanding their medications, disposing of their medications. So a lot of opportunity to grow. So we're excited at the Lammy Center to continue this vision and mission, and to work with our communities at large within Maryland and beyond to improve aging in place.
Wow, it seems like a very resourceful center. I want to say, Dr. Brandt, this has been a very enlightening conversation, as well as, you know, you provided certainly practical steps that we all can implement in our own lives. Thank you so much for taking the time.
You are so welcome. Thanks, Katie.
Yes, well, that concludes our program for today. As you can see, the voices of those 50 plus matter every day and in every way. To learn more about services for older adults in Montgomery County, please visit the Montgomery County Seniors website by visiting montgomerycountymd.gov/senior, or call the Senior Resource Line at 240-777-3000. And as always, thank you for watching 50 Plus in Montgomery County. Thanks, Dr. Brandt.
You are so